In America, there's a 66% chance you will notice signs of hair loss by age 35. Right now, more than 80 million Americans are dealing with genetic hair loss. However, many hair clinics do not explain that hair loss isn't just about losing hair, it's about understanding why it happens in the first place. In this video, you will learn the real causes of hair loss, how the hair growth cycle works, and the science-backed treatments that can help slow down or even reverse the process. If you want to protect your hairline and make better choices about your hair health, be sure to watch this video until the very end. Hair loss is much more common than many people think. By the age of 35, nearly two-thirds of men will notice some hair loss. Over their lifetime, about 85% of men will face hair thinning or balding. Women also experience this issue, with about 50% noticing hair thinning at some point in their lives. So, when is hair loss considered normal? For men, it can start anytime after puberty, but usually begins between ages 25 and 35, often due to mole pattern baldness. For women, noticeable thinning typically starts between ages 40 and 50, especially during perimenopause and menopause when hormone levels change. Don't worry if you see a few hairs falling out. Losing around 50 to 100 hairs each day is normal and part of your hair's natural growth cycle. The real issue arises when your hair falls out faster than your scalp can replace it. Now we understand that this isn't a rare condition, let's find out why we lose our hair. The most common cause of hair loss is genetics, also known as androgenetic alopecia or male and female pattern baldness. This is responsible for the majority of long-term hair loss cases. If there is a family history of hair loss, your chances of experiencing it are significantly higher. The second major factor is a hormone called dihydrotestosterone, or DHT. In people who are genetically sensitive to DHT, this hormone gradually shrinks hair follicles, causing hair to become thinner, weaker, and eventually stop growing altogether. Hormonal changes can also contribute to hair loss. Pregnancy, childbirth, menopause, PCOS, and thyroid disorders can all disrupt the normal hair growth cycle and lead to excessive shedding. Stress is another major factor. Severe emotional or physical stress can push a large number of hair follicles into a resting phase. This condition, known as telogen effluvium, often causes noticeable hair shedding 2 to 6 months after the stressful event. Nutritional deficiencies can make the problem even worse. Low levels of iron, protein, vitamin D, vitamin B12, zinc, and other essential nutrients can weaken hair growth and increase hair shedding. Finally, certain medical conditions, medications, scalp infections, excessive heat styling, chemical treatments, and tight hairstyles can all contribute to hair loss and hair thinning. Before we move on to treatments, if you're finding this video helpful so far, take a second to hit the like button and subscribe to the channel. We regularly share science-backed health content designed to help you make smarter decisions about your health and wellness. Now let's talk about the most important question: can hair loss actually be stopped, and can lost hair grow back? The answer depends largely on the cause. If your hair loss is triggered by stress, nutritional deficiencies, hormonal imbalances, or certain medical conditions, treating the underlying issue can often reduce hair fall and allow healthy hair growth to return. However, if your hair loss is caused by genetic factors and DHT sensitivity, the goal is usually to slow down the process, preserve existing hair, and stimulate new growth before the hair follicles become permanently inactive. One of the most widely used treatments is Minoxidil, also known as Rain. This topical solution helps improve blood flow to the scalp and supports hair growth. Another option is Finasteride, a prescription medication commonly used by men that helps reduce DHT levels, the hormone responsible for shrinking hair follicles. Some people also combine these treatments with microneedling, often called derma rolling. This process may help stimulate growth factors in the scalp and improve overall treatment results. Along with medical treatments, nutrition plays a critical role. Eating enough protein and maintaining healthy levels of iron, vitamin D, vitamin B12, zinc, and other essential nutrients can support stronger and healthier hair growth. Simple lifestyle changes can help as well. Managing stress, getting quality sleep, avoiding tight hairstyles, reducing excessive heat styling, and following a balanced diet can all contribute to healthier hair over time. For people with more advanced hair loss, treatments such as PRP therapy and hair transplantation may provide additional options. The most important thing to remember is that the earlier you address hair loss, the better your chances of slowing it down, preserving existing hair, and achieving the best possible results. If you found this video valuable, don't forget to like, subscribe, and turn on notifications so you never miss our upcoming health and wellness videos. Also, let us know in the comments. Have you ever experienced hair loss and what solution worked best for you? We'd love to hear your experience. Thanks for watching, and we'll see you in the next video.